Hi, everybody. Welcome to our Smile is in the Air, the Oral Health and Prevention podcast. I'm Celso da Costa, and today with us we have Professor Hervé Tassery, and we are here in the University of Odontology, so Dentistry University of Marseille, in the first GBT Summit in France. And Professor Tassery, a great name here that is pushing prevention, what is really nice. And I just knew 111 publications, citations. So that is really great. And welcome to our podcast.
Yes, welcome, Celso da Costa. Yes, it's a great opportunity to speak about the first GBT World Summit Tour. And it's a great opportunity to Marseille Dental School to start the prevention road and way with the help of EMS and most is the best thing is that we now integrate completely the GBT concept inside our document, our prevention system, and every day we work on this point, and then we completely change the paradigm of our lecture and lesson.
That is something great because we are pioneers in France. France is not a country of prevention, so to say, and we talk today about the prevalence of periodontal diseases, and average worldwide 50%, and here is 65 with the latest statistics. Why that?
Yes, certainly because Marseille it's quite a strange town because there is so many people coming from all the world, and so meaning that there is a huge melting pot of people of different thinking, and also has my I was born in Africa, so meaning the time to change the paradigm and time to push and shift all the things we believed before, and now time to introduce completely the new way to restore, new way to prevent, and new way to think and make the patient inside and in the center of our problematic.
Yes. And we had this discussion offline that you are really showing the way to the other universities how to implement prevention department, and you have a prevention department here in Marseille. So tell us a little bit how you implemented and how it's working with the students.
Yes. The main point is that we completely integrate inside the document of the different students, meaning they are mandatory to do a GBT concept with 2 patients, yes, and then to have the follow-up at 6 months or even 1 year after, meaning that it's now completely integrated inside our university. And also the main point that even we spend a lot of time to change the mind of the people inside Marseille, whatever they decided to just keep the door open, and then we go inside this open door, and then we start slowly first with 2 dental chair, and then we think to enlarge the prevention service, and to put minimum 4 or 5 dental chair with EMS system, and then to completely integrate. Meaning we would like to say that first of all, each patient coming in our dental center should pass through the prevention door, and after decided if we can bring them on the cardiologic department or the prosthetic department. But the heart of the point is you should go first in the prevention department and then decide what happened to you.
Completely agree.
Yeah.
Completely. That's great. And we got today Professor Delphine Tardiveau, that she showed that it increased in efficient or in treatments in the prevention 1,000% this year. So because it was implemented in 2021, right?
Yes.
So why you think that is so? Yeah, it has these results because it's quite a good result, 1,000%.
Yes, really it's a good result, but mainly because in fact we have all the tools to open the new paradigm concerning the prevention and minimally invasive dentistry and so on. We have some break with the prosthetic department.
Yeah.
But in the
You're gonna get there.
yes, we will struggle with them, and then make them more open mind concerning the prevention system and so on. But it's just a beginning concerning the what happened in Marseille, and then the main point that we should develop all this new way of thinking in the different in the 15 dental university in France. So time to spread the GBT concept.
GBT and know-how.
Yes.
Yeah.
Yes.
And I saw that you are a great supporter in terms of dental hygienists. You didn't stop talking about it today. How you see, because in France we don't have dental hygienists
yes, but in fact the people who work on this point will soon decide to have what they call a second level level 2 assistant, meaning that they start to open the door of a new kind of dental assistant called little hygienist, but always under control of the dentist. Yes, but
it's a first step. It's a first
yes,
step.
It's a first step. Yes, just have an hygienist. Yes, you can control her. It doesn't matter at all. And then after the second point, there will be enough free to
opener. Let's try it to see how beneficial it is, the teamwork, and then move forward for the help of our patients.
So we have a lot of work to introduce the MI dentistry, to introduce the GBT and all the prevention step, and to reduce in fact, every year in France, the dental health cost increase. And that should not. If we really work with a prevention mind, that should decrease. Less crown, less implant, less and more hygiene, and more prevention.
Prevention. Prevention is the key. Let's attack the root of the problem instead of just treating.
If you control the microbiota, you are the king.
Exactly. But tell me more, because crazy stuff that you are doing here, like your presentation today on the GBT Summit Marseille, was something else. Like how you are working and trying stuff and trying to get prevention during the treatment. Actually, let's treat the biofilm. I don't gonna close this tooth without having a good management of the biofilm.
Yes.
Tell me more.
But
it was just a little bit glimpse, and I want more. I need more.
Yes, it's just because we completely changed our clinical paradigm, and meaning that we this 10 days before we decided that we are definitely blind. So time to open our eyes, to use magnification, and to work, if possible, under microscope, and combine all this tool with photonic signal. So we have been working a lot on the fluorescent signal, and then we also on the infrared signal, and there is also new wavelength which can be used also. So we decided, please, why not use all the tools with all the different wavelengths, and try if that will improve our clinical restorative work. And we succeed. That means that now we have a huge magnification, so we completely control what we do. And then sometimes we are in sort of bad mood or depression, because we saw so lot of kind of biofilm of fissure, complex shape, and so on. So time to definitely kill all the cardiologic and
just
dusty
combine
cardiologic
practice, right?
Yes,
like,
combine practice and use all the new powder without damaging the tooth. Why not using ion release biomaterial? Why not? Please use it. and develop slow dentistry. Take your time to see, take your time to diagnose, take your time to better understand, and then certainly you will make a better work.
I like this because we saw that in the past dentistry was kind of dividing in multiple branches and be super specific, super
Yes.
specialized. And what you're doing is now regrouping again everything,
Yes.
make all the different departments to work together for the benefit of the patient.
Absolutely.
And what is the biggest benefit of the patient when we have these combined techniques or departments?
Meaning that we will reduce the risk to have caries and secondary caries. So, and without globally, without any effort for the patient, you just have to follow us. And then when we use erythritol and powder and airflow, there is no pain. So time to, the main point is to be able to integrate the individual coaching given by the GBT in a new restorative paradigm.
Yeah.
Yes, to improve the dental health of your patient.
Well, that's amazing work. And for the listeners that are listening to the podcast, they are hearing this noise from the students. So we are in the university in Marseille.
Yes.
So it's nice, and I think you bring the energy to the students. I got some of them coming to me after the lecture and asking, "Can I talk with you about dental hygienists? How you are doing prevention? How you think we can apply it in France?" I think this is coming also from you and
Yes.
your colleagues here.
Absolutely.
So amazing work again. Thank you so much.
Thank you.
Thank you, folks, for listening also for this podcast.
Absolutely.
So here you have Professor Hervé Tassery in this really exposing his opinion that I like a lot.
Thank
and
you.
I need to spend more time with you. You need to show me all the cases because it wasn't enough what you showed me in this last 45 minutes. So thank you again. And
You're warmly welcome.
hope to see you soon.
Thank you.
And to our listeners, also thank you, and see you in the next podcast.
Thank you.
Thank you.
Bye-bye.
Merci.